Breaking news! Biofilms are back! Welcome everyone to Speedy Science, where you get the latest scoop on infectious diseases.
So, what exactly are biofilms?
Great question! Biofilms are communities of bacteria cells which are resistant to antibiotics. These communities thrive in wet environments, and depending on the type of bacteria, they can survive with limited nutrients or oxygen.
I've heard that biofilms are often found in patients with cystic fibrosis, also known as CF. Is this true?
Yes, biofilms can be found in many different types of patients. Cystic fibrosis patients happen to be one of them. Patients with CF and infections caused by biofilms are generally in worse clinical condition than patients without the infection. We're going to tune into the local hospital to see how biofilms affect CF patients. Neha, could you explain what happens when you have CF?
Of course, Anushka. CF is an inherited disorder that causes severe damage to the lungs, digestive system, and other organs in the body. Typically, patients who have CF have respiratory and gastrointestinal complications, as well as delayed growth.
Earlier today, I mentioned that CF patients can develop biofilms. Can you tell us a little more about the most common type of bacteria that affects CF patients?
Sure, it's called Pseudomonas Aeruginosa, and it can cause infections. Symptoms of the infection can include back pain, swelling, and redness in the eye, joint pain, headaches, and skin rashes.
Do all CF patients get Pseudomonas infections?
No, not all of them. Pseudomonas infections can happen in many different patients, but when they occur in CF patients, they can develop the symptoms I mentioned. We're here with Dr. Maya Joy, and she's going to talk to us about some complications she has experienced with biofilms. What specifically about biofilms make them so hard to kill off?
As you guys discussed earlier, biofilms produce extracellular polymeric substances, or EPS, which is a gel-type substance that lowers the toxicity of the antibiotics before they manage to reach the bacteria cells.
Why are CF patients prone to developing this infection if Pseudomonas is a relatively common bacteria?
CF causes abnormally thick secretions with a mucus-like texture, and when this builds up in the lungs, it allows Pseudomonas to build up and cause the infection. Like you said, Pseudomonas is quite a common bacteria, but non-immunocompromised individuals are at lower risk for developing an infection.
Dr. Joy, are there any treatments that could be used to slow down the process for CF patients with Pseudomonas infections?
This can be prevented by using enzymes that dissolve the biofilm matrix. These enzymes are denase and alginate lyase. They increase Pseudomonas susceptibility to antibiotics, slowing down the infection.
And that ends our interview for today. Back to you guys at the studio.
Thank you, Dr. Joy, for that. And thank you all for tuning in to Speedy Science.
See you guys next time!